In this brief video tutorial, we'll have a look at the anatomy of the left lung. This is the medial or mediastinal surface of the lung. And what we can see is we can see the cardiac impression, which is rather large. We can also see that there's an impression for the arch of the aorta and the descending aorta. We can see the oblique fissure dividing the lung into a superior lobe and an inferior lobe. It also has an inferior border and an anterior border. The diaphragmatic surface can be seen in the middle of the inferior border, and we can also identify the hilum of the lung. The hilum of the lung is a hollow indentation where major structures enter and exit. These include the pulmonary artery, we have the pulmonary veins, they carry oxygenated blood back to the heart, and we have the left primary bronchus. The superior lobe of the left lung has a unique anatomical structure known as the linguilla. Finally, we can also identify the pulmonary ligament, and this allows for movement of the primary structures in the hilum to move down into this potential space during respiration. The pulmonary ligament also extends all the way around the hilum.
This video was partially sponsored by Dirisana, an EU-funded project.